Good morning, good evening, and good afternoon to everybody joining us live, and thank you to those listening to us afterwards via the recording of this event. I'm very excited to be co-moderating this event today, part of the FIP Transforming Vaccination Globally, Regionally, and Nationally program. If we go to the next slide, please, I'd like to introduce my co-moderator today, Dr. Ayman Nuruddin. Thank you, Dr. Ayman, for joining us. He'll be introducing the speakers later on, and I'll just do a little bit of an introduction. But if you've attended one of our events before, especially the Transforming Vaccination series, then you should be very familiar of what this program is really about and how today's event fits within the whole agenda. Next slide, please. The webinar is being recorded and live streamed via YouTube. The recording will be available on our website, events.fip.org, for your viewing afterwards. Please feel free to ask questions for the panelists using the Q&A box at the bottom of the panel, of the Zoom panel. We will pick those questions up later. You are, of course, more than welcome to always provide feedback to FIP webinars at fip.org about our events in general. And if you aren't already, please consider becoming a member of FIP and can go on our website for more information on member benefits and how you can become a member. Thank you in advance for that. The FIP Transforming Vaccination Regionally and Globally program for 2021 follows and builds on the successes of the 2020 program. Let's recap the key outcomes of that program from last year. That was at the time the first FIP digital transformation outcome-based online program. It was wholly underpinned by the FIP development goals, and it resulted in a global FIP commitment to action on vaccination in pharmacies, as well as a digital collection, the FIP Transforming Vaccination Collection, which summed up all of the outcomes of this program. We built on that program to devise and develop the 2021 Transforming Vaccination Agenda. Next slide, please. The Transforming Vaccination 2021 consists of 12 events running over 2 series. Series 1 has concluded, and it focused on equity in vaccinations globally. It comprised 5 episodes which have been delivered already, and we are now in the middle of Series 2, Sustainability in Vaccinations Regionally and Nationally, where we are looking at the needs across vaccinations in terms of widening access, equity, and sustainability across the regions. So it includes regional roundtables as well as leadership summit towards the end of the program. Next slide, please. So the first of the 2 series had the 5 episodes, which I mentioned. We explored age, gender, literacy, education, collaboration, and working together as well, in addition to the opening event. Next slide, please. And the second series has 7 events, including 6 regional roundtables. Today's regional roundtable is on the Eastern Mediterranean region, where we will discuss and identify priorities for sustainable access to vaccinations through pharmacies around the world. We'll end the program with a global leadership summit in which we present a commitment to action on sustainable and equitable access to vaccines through pharmacies. Next slide, please. So these recap really, again, the key outcomes, the events, the goal commitment, as well as a special policy collection, another collection this year that again captures all of the outcomes of this program. So let us just run through some of the key priorities for this region, the Eastern Mediterranean region, which have emerged during the 2020 program. We look forward to hearing some of these priorities and status updates from the countries today, and we can always compare how things are going. So some of the regional needs and priorities identified to transform vaccination for this region last year were ensuring undergraduate courses include vaccination training, providing postgraduate training as well, development of guidelines and framework for vaccine delivery, lobbying of decision makers as a critical activity. It was identified that that should be accompanied with the development of training guidelines and framework of vaccine delivery to ensure that decision makers can see the evidence of pharmacists being qualified to deliver vaccination. And working collaboratively with international organizations such as the World Health Organization and others to provide significant support to the lobbying role of local organizations. So we can see education and training being an important topic, and support for policy making and lobbying of decision makers. Some challenges experienced, including barriers from other healthcare workers who currently provide vaccination. Some other lessons include the development of pharmacy capacity should be in accordance with the lobbying process, so that pharmacy capacity to vaccinate exists or is being developed at the same time the legislation is being passed. So there is that sort of alignment. Some legislative enablers and barriers emerging in the region. The primary legislation enablers are those that recognize pharmacists as vaccinators under the law. So law is an important enabler. Other factors include laws that control the distribution and funding of vaccines, and ensuring these do not prevent pharmacists from participating. So law is a really important, and legal jurisdictions are really important enablers and barriers at the same time for this region. So thank you for that. That was a summary from me. I'll pass on to Dr. Ayman. We have today's panelists, Madiha Malik, Rilla Darwish, Ahmed Abdul Bari. Next slide, please. Ziad Nassour and Mohammed Nuzali. I know Dr. Ayman will be introducing each and every one of them as we hear from them all. Thank you very much. Dr. Ayman, the floor is yours.
Thanks, Lina. Thanks a lot, everyone. Good morning, good afternoon, good evening to everyone. And thank you for attending this very interesting and very informative session where we discuss vaccination in the EMRO area. At the end of the day, we need to make sure that we achieve the following outcome, that we, during the session, we need to identify the regional needs for the Mediterranean area, identify the priorities, which is very important in this region, countries, with regard to equity and access to vaccination. This is number one goal that we need to achieve during this discussion. And also we need to discuss barriers and challenges and regional needs in relation to policy setting. And this is very important because policy is a key partner in the decision here and key for the success of the programs. So we need to discuss that. This will be through the discussion today. I hope you will enjoy it. And the dear FIP members, the stakeholders and partners from the Eastern Mediterranean region join us for a true regional perspective. I'll start now with welcoming our speakers. I'll start with Dr. Madiha Malik. Dr. Madiha Malik is a professor and director in Hamad Institute of Pharmaceutical Sciences, Hamdard University, Islamabad campus in Pakistan. Dr. Madiha, welcome. Please introduce yourself and welcome to the floor.
Thank you so much, Dr. Ahmed. Assalamu alaikum and good morning, good afternoon to everyone. First of all, I would like to thank FIP for giving me this opportunity to present at this amazing platform. And my name is Dr. Madiha Malik, and I am basically a professor by profession. I'm a pharmacist, and I'm working as director Hamdard Institute at Hamdard Institute of Pharmaceutical Department of University of Islamabad. Today, I would like to discuss some challenges for sustainable and equitable access to vaccine in Pakistan and what is the national approach of Pakistan in this global crisis. Farah, can you move on to the next slide, please? Next, please. Okay, so I would like to share a brief history of how COVID-19 epidemic progressed in Pakistan. So it was back in 2020. The first case of COVID-19 was reported on February 26, 2020 in Karachi in Sindh. Like this is one of the provinces of Pakistan. For our next piece. And then on the same day, it was also confirmed in the federal, in the capital of Pakistan also. For our next. So within 15 days, the number of total confirmed cases, the positive cases basically reached to 20 out of 471 suspected cases, and with highest burden in one of the provinces, that is the Sindh. Next. So now there was an interesting thing that all of the confirmed cases had a recent travel history from Iran, Syria, and London. So this was one of the things which was identified when we look at the trends, like where this epidemic basically progress was started in Pakistan. Fra, can you move on to the next slide, please? So I would like to quickly share the COVID-19 epidemic statistics with you till date. So approximately 1.2 million of the confirmed cases of COVID-19 have been reported in Pakistan till date, and out of which the total active cases are 44,000 approximately. The deaths are approximately 28,000, and rest of the people have recovered. Next. So now I would like to share that how the vaccination drive basically started in Pakistan. So the first batch of Sinopharm vaccine was received by the country in late January 2021, and vaccination program basically kicked off among the healthcare worker. Next, Farah, please. So basically, first of all, at the first level, all the healthcare professionals in Pakistan were being vaccinated, and they were provided free of cost vaccination. And in the second round, all the elderly people who were above the age of 65 years old were basically vaccinated for Pakistan and in Pakistan. And then the vaccination campaign or the drive focused on the people who were above the age of 30 years, and now finally, the Pakistan is focusing on vaccinating, and they have opened up the vaccination for the children in the age group of 12 to 18 years. Next slide, please. So next. So now more than 8 million doses of COVID-19 vaccines have arrived in Pakistan through COVID so far, and so so this includes like 2.4 million doses of AstraZeneca, around 0.1 million doses of Pfizer, and 5.5 million doses of Moderna. Next slide, please. So if I share the statistics of vaccination till 27 September in Pakistan, approximately 5.6 million people have received the first dose of vaccine in Pakistan, and approximately 2.5 million people are fully vaccinated in Pakistan till 27 September 2021. Next. So now I would like to discuss few of the strengths which we, like as a country with with a developing country, basically focused for achieving the equity, accessibility, and sustainability for vaccination, and they were quite successful in this. So Pakistan is the only country which is administering 8 vaccines to its population. That is the maximum variety of vaccinations. They include Sinopharm, Sinovac, Pfizer, Moderna, AstraZeneca, CanSino, Sputnik, and Pakvac, which is basically Pakistan have also formulated their own, introduced their own vaccine. Next. Aiming to vaccinate about 70 million people by the end of 2021, the government of Pakistan has recently committed $1.5 billion to procure the COVID-19 vaccine, which is again a very you can say one of the very instrumental step for this vaccination drive. Next. So what we see, like how I see Pakistan has achieved what are the strengths which I see from the perspective of a country, that first of all, free of cost vaccine was available for majority of the public and private sector facilities, even at the tertiary, primary, and secondary level, which ensured or guaranteed its accessibility and equity. Next. So initiation of outreach programs, particularly targeting the marginalized segment of society, was another achievement for promoting equity and accessibility among the masses by the government of Pakistan. Next. And one of a very important and vital feature of this vaccination drive, which we have seen, was door-to-door vaccination programs, which were initiated in some of the districts and which also strengthened the access to vaccines by all the segments. Next slide, please. So now Pakistan government was very instrumental. For the first time, the Ministry of Health was very inclusive for the IT involvement in the COVID vaccination drive. And I would like to share a few of the IT initiatives for Pakistan government to combat the COVID-19 vaccination, to combat the COVID-19 pandemic, which were really very successful and instrumental in promoting the equity. The first was the SOP violation reporting. That was a launch of WhatsApp number for registration of COVID-19 related violation by the public. Next. Then they introduced the resource management system, basically which facilitates the decision making in terms of establishment of correct need assessment and capacity enhancement. Next, then they also launched an app with the name of Arc Megaban, which provide the real-time visibility of hospital based on the location and color. It was also color-coded, which showed the pre-availability of beds and ventilators in those particular hospitals. Next. So they also had introduced this integrated disease information management system that is a national repository for all COVID-19 related data, and which actually is one of the biggest achievement in the use of IT technology in this COVID-19 vaccination drive by the government of Pakistan. Next. So they also introduced a WhatsApp chat board for the health worker where they can punch their complaint as a text message to them, and they were facilitated on a very short time. Next. Then there was also a COVID-19 telehealth portal which was introduced for the doctors in Pakistan, where they can sign up for the volunteer their time for a free consultation with the patients. Next slide. Next. So there were also some few of the areas were identified where isolation hospitals, infectious treatment centers were where they were designated for the treatment of only COVID-19 in Pakistan. Next. Then there was also a program. There was also a program which was introduced by the government with the name of We Care, and the aim was to provide the adequate personal protective equipment to the health workers and other items according to the international standards in the hospitals. Next. Then there was Education Institute monitoring system, and there were the national central database were estimated more than 0.2 million education institutions for monitoring COVID positive cases. And I'm very glad to share that in Pakistan, more than 60% of the teachers, students, and school staffs have been education institutes have been vaccinated now. Next. Now, there was also a very major step which was taken by the government of Pakistan, and they introduced the guidelines for COVID-19 in Pakistan, which included the treatment guidelines updates, and then the guidelines for the additional doses for travel, guidelines for Independence Day celebration programs, guidelines for mass gathering for different events. Next. Then there were guidelines for zoning of hospitals, for social distances, for home isolation, for quarantine facility establishment, instructions for testing of COVID-19, and then there were advisories for disinfectants. Next. The guidelines also included for air transport of COVID positive dead bodies, the burial and the safe management, and there were also guidelines for neonates of mothers, and then the preventive guidelines for industries and workers. Next. So I would like to share one of the success story in Pakistan, and next please. And I'm very glad to share that this campaign was led by a pharmacist who's a senior inspector in the FDI, and as well as the Secretary of Quality Control Board, who basically led the mass vaccination campaign in the federal. And now it was also endorsed and acknowledged by the high government officials, the role of the pharmacist in this. And like federal is now one of those you can say the cities in Pakistan with the highest vaccination rate, like almost at least 50% of the eligible population, more than 71% of the Islamabad. Out of that, 71% of the population in Islamabad are fully vaccinated till date. Next. It was also endorsed by NCOC that this vaccination drive was a success in itself, and it was also suggested to replicate the same model in different provinces. Next. Next. So what were the few challenges which we have seen during this vaccination drive to make this vaccine accessible and sustainable to the masses was the false propaganda against vaccine efficacy. There are certain group of people who have certain cultural and religious barrier, because of which there were few people who were propagating about the efficacy of the vaccine, due to which there might be underreporting or some in that particular region the vaccines were not the vaccination rate was quite low. Next. Then there were lack of awareness among marginalized communities. Next. Underreporting of confirmed cases due to low screening, as obviously the cost of the test is quite high in Pakistan and everybody cannot afford it. And there are few of the, you can say, centers which are offering the free testing services. So the underreporting is one of the challenge which Pakistan is facing now. Next. There were concerns about vaccine side effects. But DRAP has also taken another initiative, and they have launched an app for the reporting of any ADRs or side effects after the administration of vaccine through that app to the government of Pakistan. Next. There was one of the things which we have seen during this pandemic was a disconnect between the federal and provincial policies, and that is one of the reasons that the vaccination rate was quite high in the federal. But as far as if you would see in certain provinces, due to the disconnect and not the following of one of the, common policy across Pakistan, there might be certain areas or there might be certain provinces where vaccination rate has not been that successful, which it should be. Next. So what policy change, which I suggest that we can adapt for improving access to vaccine accessibility and sustainability, is the adoption of nudge behavioral science approach in the government strategy to increase the vaccination rate. Next. That is involving the vital stakeholders, such as the non-governmental organizations, health professionals, community leaders, and especially the religious scholars to spread the awareness about Pakistan. But somehow I'm very confident that the government has done quite well. Now we are back, institutes are open, people are coming back, people are working, and I hope that the situation will be better in the coming days. Thank you very much.
Thank you, Dr. Madiha, for this nice presentation. I hope that we learned a lot now about what's happening about vaccination in Pakistan, and I applaud your efforts in this area there. This is a really great job. Now we move to the second speaker, Prof. Rola Darwish. Dr. Rola is a professor at the University of Jordan. She's a WDG9 lead and member of Executive Committee of FIP Academic Section and CPD Chair of Jordan Pharmacists Association. Dr. Rola, go ahead.
Thank you, Dr. Ayman. It's a great pleasure to be here among you all, dear colleagues, to talk about sustainable and equitable access to vaccine from Jordan perspective. Next slide, please. Just a glimpse about Jordan. Jordan has a population of around 10 million. It has many ethnic groups, including refugees. The land area is about 89,000 kilometers square, and Jordan is classified as low middle income country with a young population. Next slide, please. Now some beliefs on vaccines. Vaccines are known to be most common disease preventative approach because of its safety and cost effectiveness, and also because of the low risk. Here, the benefits almost all the time outweigh the potential risk involved. Actually, recently, WHO reported that more than 10 million children under the age of 5 pass away every year. 1.4 million of those are due to vaccine preventable diseases. And that's why it's very important to look at these statistics and effectively apply vaccine enforcing policies to minimize avoidable deaths in different groups. Next slide, please. Now, if we look at Jordan, it is considered as leading country in providing essential vaccines. We have national vaccination program, which is responsible for around 95% of child vaccination as part of the Ministry of Health sponsored free program. It includes many vaccines, as you can see. And nowadays, because of COVID-19 pandemic, the situation dictates upgrading of national healthcare system to expand the scope of immunizers. Next slide, please. This is the statistics, which is in Jordan recently. As you can see, as from the 3rd of January 2020 till the 5th of October 2021, there has been around 830,000 confirmed cases of COVID-19 and about 11,000 deaths reported to the WHO. The PCR positivity is 3.71%. As you can see, we had two peaks in Jordan. The first peak started in September and into November and finished in January. The second peak started in February into March and finished in mid-May. Now the cases are sustainable. And this is the same thing goes for the death. Next slide, please. Now for the vaccination, you can see that people in Jordan, some of them are fully vaccinated. Actually, around 3 million people are fully vaccinated. That makes 32%. And some of them are partially vaccinated, 418,000, which makes 4.1%. If you look at Jordan among the world, you can see that Jordan is considered in the middle, let's say, in vaccination. That means we have to improve even more in order to cover this pandemic. The total number as for 5th of October 2021, we find that we have a total of 7.04 million vaccine doses that have been administered. Next slide, please. Vaccine equity, which is access and allocation of vaccine based on principle grounded in the right of every human to enjoy the highest attainable standard of health without any distinction in relation to race, religion, political beliefs, or any other social conditions have been acknowledged by Jordan. We have, as I said earlier, the National Vaccination Campaign, which aims to fight COVID-19 and is carried out by Ministry of Health and the National Center for Security and Management. Here it states that any individual on the Jordanian soil is eligible to receive the vaccine, and it is free of charge. However, receiving the vaccine is not mandatory, but everyone is encouraged to register in a certain platform to receive the vaccine, especially if they are of certain criteria, like, for example, being an elderly or suffer from chronic illnesses such as heart diseases, cancer, or other type of diseases. We have also a platform for registration. It started in the 13th of January 2021, and it has easy access with clear instructions. Actually, if you look at the number of people assigning to this platform, it's over 4 million. A very important point is that we have many centers for immunization. We have 130 centers distributed all over the country. In addition, we have 8 drive-through centers and 27 mobile clinics, which reach the patient who cannot reach these centers. So it's like door-to-door services, all of them under the Ministry of Health supervision, and they are working after hours and even in the weekends. Next slide, please. There is a strong consensus globally that COVID-19 vaccine is likely the most effective approach to sustainably control the COVID-19 pandemic. And to do so, Jordan have different approaches. Jordan uses a wide range of different types of vaccines. We have Sinopharm, Pfizer, AstraZeneca, Sputnik, and we have, Jordan also allocated budget to ensure continuous supply of these vaccines. Also training of healthcare providers from different sectors, not only the physician or the nurses, on best practice and immunization. Awareness campaigns on the importance of immunization has been distributed, encouraging scientists and manufacturers to work on vaccine as product is effective in Jordan. Next slide, please. Now, like any other country, Jordan has some weaknesses and challenges regarding vaccination. And being a low middle income country, as I just mentioned earlier, the cost is an issue. We find that some pharmaceutical companies have set lower vaccine prices to the developing countries, including Jordan, or at least have committed to sell without profit for the duration of the pandemic. However, others did not. Also, COVAX facility will probably fail to secure equitable access to vaccine in developing countries, despite the rapid development of successful vaccine candidates. And this is because the allocation framework will be unable to operate as intended. Another weakness is delay of communication. especially with public in regard of vaccine side effects and efficacy. Premature data, which is common all over the world on vaccine, is reflected on acceptability of public to vaccines. There are also many barriers to local production. Now we know that several developing countries, including Jordan, have the capacity to manufacture vaccine. However, the intellectual property rights and limited technology transfer remains a barrier to build local production capacity. Also, there are logistics and infrastructure challenges, which is found in every developing country. As such, every developing country must try to enforce or communicate vaccination programs to target key risk groups and prioritize those most in danger of being left behind. Next slide, please. Now, very important weakness and challenge is the hesitancy to vaccination, not only among the public, but also among the healthcare workers. If you take a look at this study, you can see that the public hesitancy, next please, Farah. You can see that the hesitancy among public is very high. Almost half of the public is hesitant to take the vaccination, and only 13% are accepting this vaccination. The same thing goes for the healthcare providers. Next, Farah, please. As you can see, Jordan, the healthcare workers in Jordan, about 34% they refuse to take or hesitant to take the vaccine, and some of them look at the type of the vaccine and prefer to wait before taking the vaccine. Probably this is because the multi-type of vaccines available, and of course this is governed by availability. Here, the efficiency of some of these vaccines are less than 50%, and some of them have dramatic side effects. All this caused confusion and hesitancy among the public and the healthcare workers. However, this has been overcome by more available doses of one type of vaccine recently. Next slide, please. Now, Jordan have many strengths in regard of vaccination. The media played a great role in enhancing vaccination rate. They recruited key persons and celebrities to accept vaccine, and even our king was on the media, and this encouraged many public to be vaccinated. Also, distributing facts that vaccination will reduce the effect of the disease and lower mortality rate. Again, regulation were enforced where people are either vaccinated or they have to make PCR at the beginning and at the end of every week before they can go to work. Different institutes and shops have to have their staff vaccinated or again provide PCR, as I just mentioned. As for universities and schools, 93% of the teaching staff are fully vaccinated, and some health institutes mandates that all healthcare personnel to be fully vaccinated. Next slide, please. Now, it's very important during this crisis to empower pharmacists. We know that pharmacists are well-suited healthcare immunizers, and after proper training and certification can play a great role in immunization. They have strong relations and accessibility in their local community. And after all this training, they will become the experts on vaccines, on the mode of action, effect onset, drug-drug interaction, side effects, pharmacokinetics, as well as other administrative roles that we know about pharmacists, which regarding vaccination supply and proper storage conditions. And we have found that in the literature, there is support for the role of pharmacists as immunizers, and actually it increased the vaccination rate and consequently reduced the likelihood of unnecessary vaccine preventable diseases. Also, pharmacists, after all this training, they can become educators and advisors for immunization. Next slide, please. Now, Jordan Pharmaceutical Association, in collaboration with FIP, have signed the Amman Commitment to Action on Primary Healthcare that mandates transformation strategies and programs. Jordan Pharmaceutical Association accordingly formed a vaccination committee to follow up with stakeholders and to adjust legislations to enable and qualify pharmacists administering vaccines. Many awareness and educational workshops, as well as training workshops to enable pharmacists administer vaccination. We started with the flu vaccine for this issue. And vaccination campaigns were conducted by a group of pharmacists to the elderly in the nursing home. Next slide, please. Next, yes. In response to all this effort, the new legislations have been performed where influenza vaccination can now be administered by pharmacists in Jordan. However, pharmacists need to hold a certification from Jordan Pharmaceutical Association confirming their competency to vaccinate, and pharmacy must be registered as well by Jordan Drug Food Association. Now, with the availability of COVID-19 vaccine, there is recommendation to involve pharmacists and different healthcare providers in the policy. Next slide, please. Now, to conclude, it's very important to increase the coverage and guarantee equal access to COVID-19 vaccine, regardless of social, administrative, or legal status in the country, to ensure effective prevention within the same country and all over. Addressing vaccine hesitancy is very important and can be done through awareness campaigns and public engagement, as well as enhancing transparency and coherent public communication. Frontline healthcare workers, in particular pharmacists, can play a central role in encouraging COVID-19 vaccination. Now, by vaccinating those healthcare workers, not only we ensure adequate workforce to treat infected patients, but also we can allow medical authority figures like pharmacists and others to share their positive vaccination experience with patients. Next slide. And thank you for listening.
Thank you, Dr. Aurora, for this nice, interesting, enchanting presentation, especially about mentioning the role of pharmacists for vaccination, and hopefully beyond the flu will be for the COVID-19 and vaccination activities. This is very interesting to hear this type of agreements with the FIP. Now we'll move to Mr. Ahmed Abdelbari. He is a senior regulatory affairs pharmacist at the National Health Regulatory Authority in Bahrain. Mr. Ahmed, tfaddal.
Hi, assalamu alaikum. Hello, everyone. I hope you're all having a wonderful day. My name is Ahmed Abdelbari. I'm a senior regulatory affairs pharmacist working for the Health Authority of Bahrain. Now, first of all, let me thank you, FIP, for having me here today. It is such an honor to be with you and your followers. I really appreciate the wealth of knowledge you're sharing with the world, and I have a lot of respect for your goals, especially now that you're dealing with vaccination. All right, next slide, please. So for my part, I will be presenting to you all the impact of regulatory implementation, which is my area of expertise on vaccine equity, access, and sustainability. And also, since it is the hottest topic right now, the changes brought by COVID-19 on how we deal with vaccines. So I will be presenting this in the point of view of a pharmacist who specializes in regulatory affairs. Next slide, please. So the objectives of my presentation are, first is to introduce myself and what I do and how I got deeply involved with vaccines. And next is to discuss how vaccinations are carried out here in Bahrain, as well as the kingdom's strengths and priorities. Of course, I will also mention where we fall short, the weaknesses and the challenges we're facing. And finally, a policy change which I believe may help increase access to vaccination. Farah? Right, just to share a bit about my story, I started out like most pharmacists, graduated college, passed my licensure exam, excited about a fresh career, dispensing medications and sharing my hard-earned knowledge in pharmacology. However, I found myself not behind a counter or a hospital, but in an office. So there I was in my 20s, instead of dispensing medications, I became a part of a team that actually reviews and evaluates medications for the country. Now, going back, I remember in 2015, the first file I received was an ORS, if you can believe it, oral rehydration salts. Now, over the years, of course, that changed into biologicals and now vaccines. Now, fast forward in 2020, I was given the most important task of my career, which is to get involved in the evaluation of COVID-19 vaccines. Now, let us not forget, everyone, that at the end of 2020, it was a very different time. We did not have all the available vaccines yet, and there was this huge uncertainty of what is coming next. Now, I can tell you from the moment the first vaccine was approved, it was just this huge morale boost for everyone, as if the steps to go back to normalcy have been jump-started. Now, before I talk about vaccination, equity, access, and sustainability, allow me to just share my point of view on vaccination in general as a regulator. Now, for most professionals, when you think about vaccines, you immediately picture an ampule or a vial, something physical. But to a regulator, it's not the case. Like, to us, this will come in the form of a large file, and we are tasked to review the quality, safety, and efficacy of this file before we authorize it for public use. So you can just imagine the responsibility that goes with it. So right there, it is very clear that the approval process is at the very top of what we can call the steps leading to patient access. Without regulatory approval, there will be no vaccines for the people to use. So regulatory affairs is the starting point. And because it is the starting point, it is very important for people like me to do our best as efficiently and quickly as possible to get vaccines approved out of our desks and into the lives of the patients. I like to call this journey from dossier to dose. See, this is what happens behind the scenes. By the time the doctors, nurses, or pharmacists administer the vaccine, a lot has already happened behind the scenes. Now, of course, as regulators, we do not want to be the cause of delay. Next slide, please, Farah. So let's look at Bahrain. According to national reports, we have achieved 100% of vaccination among children against measles, polio, diphtheria, and tetanus. I believe this is the most important thing to mention here. Vaccines, particularly for the most vulnerable, should be top priority. In Bahrain, vaccines are also given for free in the health centers for a minimal fee. COVID-19 vaccines are given for free. Now, vaccines are available in health centers for everyone. And by everyone, I mean Bahrain citizens and foreign workers as well have an equal opportunity. Later, I will show you how health centers play a very important role in ensuring vaccine access. I would also like to mention that we have successfully vaccinated over 70% of the adult population against COVID-19. This screenshot from WHO was from July of this year, and the numbers are even better now. Next slide, please. All right, one of the strengths of Bahrain is its population. Now, I believe, Dr. Rulo, we are smaller than Amman. So right now we have less than 2 million people in the kingdom. And with less people, the burden of providing vaccines to everyone is surely less compared to more populated countries. Bahrain also has a geographical advantage with a total land mass of roughly 765 square kilometers. It is far smaller than most cities, not most countries, smaller than most cities, which again makes access easier since you only have to drive a few minutes to an hour to reach a location where vaccines are being offered. Bahrain also has a strong focus on primary healthcare and mother and child care. Vaccinations for children are being offered in schools and health centers across the kingdom. Now, I mentioned the role of regulators earlier, and in NHRA, we have a robust regulatory approach to vaccines. using previous experiences to help us evaluate new vaccines faster and better. At NHRA, vaccines are always prioritized, so more attention will be given to vaccines more than any other drug application. As a response to COVID-19, we had to do a more proactive approach in securing vaccines, which involves actively seeking vaccines in development, exploring options for their submission for emergency use in the kingdom. This is when we issued our national initiative for the emergency use of vaccines, which in summary is a very straightforward list of requirements for a rolling review. So by doing this, it helped us get a head start early on in order to get vaccines before things got worse. Next slide, please. So I mentioned earlier Bahrain's geographical advantage. Majority of the inhabited areas in the kingdom are up north. And on the right here, you will see how the health centers are spread out evenly across the map. So people are assigned a health center based on where they live, or here we call it block numbers. So in a way, this ensures everyone has access to their designated health center, while at the same time avoids overcrowding. Now, I believe this is where Bahrain really shines, the health centers being the focal point of vaccination. Now, combine this with a small landmass, manageable population, and a robust regulatory framework, you get vaccination that is accessible and equal to everyone. Next slide, please. Now, where Bahrain falls short is probably the fact that we do not have the practice of vaccination in pharmacies or by pharmacists. There is also a need for more vaccine regulatory experts to help us do our jobs and improve the process even more. However, I would like to just point out that the strengths do overshadow the weaknesses because everyone has equal access to vaccines. Fair? Next slide, please. Thank you. So now let's talk about the policies and how it can have a positive or even negative impact on access to vaccination. Now let us look at how the process usually goes. As I have mentioned earlier, the first step in the process is regulatory approval. And you can see here how the other steps leading to the end goal, which is patient access. Now, each step takes time, expertise, and manpower. It would be difficult to talk about vaccines or vaccine access without talking about regulatory approval. So this is where my focus is. My goal is to, as a regulator, reduce the time it takes for regulatory approval to allow the other steps to move forward. Just imagine if regulatory approval of a vaccine will take a year or more. That is just a huge blow to healthcare overall. Next slide, please. So let's talk about a policy change in a regulatory context. First, we must treat vaccines differently because they do deserve, in my opinion, more attention. Let's look at it this way. To have a healthy population, people need to get vaccinated. Delaying vaccination puts people at risk. So let us prioritize a preventative measure. Now, in order to do that, as regulators, we must mobilize our resources to focus on vaccines when needed. We need to be flexible. For example, if you lack manpower needed to conclude a vaccine review, consider temporarily assigning more members to finish it. For example, if a team is working on a beta blocker, like we don't have enough already, and if they're qualified to work on vaccines, why not use them? If you lack the expertise to do an effective review, consider involving experts, doctors, in the review process, either nationally or from abroad. The worst thing is if we can just remove whatever delays the process as early as possible. This is the best way to tackle this. Now, I agree that vaccines are more challenging to review because they are given to healthy people, obviously. It is not the same as reviewing a specific drug for a specific cure or illness. And there are a lot of variables, which is why the necessary adjustments need to be made. Another thing I would like to mention is making new policies specific to the review and approval of vaccines. I do not believe in a one-size-fits-all approach. and vaccines must be treated differently. Next slide, please. Now, with regards to COVID-19 vaccines, in Bahrain, we're using a three-pronged approach where the quality, safety, and efficacy are reviewed simultaneously at the same time. The vaccine will be approved once all three parties reach a consensus. Now, to optimize this process, the entire review procedure is being done at the same time with different experts. So for this, this has proved to be very effective. We have members focusing on quality, like how the vaccine was made, for example, and the reliability of the manufacturing sites that make them. And then we have doctors that are experts in clinical trials and immunization to review the safety and efficacy aspects of the vaccine. And since we're doing a rolling review, the companies are required to update us each time there is something new that comes out. Next slide, please. Now, finally, I would like to show everyone the screenshot from our Be Aware app. This is what we're using nationally. So as of October 2, we have given the second dose of the vaccine to more than 1 million people in Bahrain, while those at a higher risk are given the booster dose as well. Now, we would not be able to reach these numbers without an effective regulatory process. Thank you, everyone. That's all.
Thank you, Ahmed, for this. Move to Dr. Ziad Mansour. Dr. Ziad is the former president of the Lebanese Order of Pharmacists in Lebanon. Dr. Ziad, go ahead.
Thank you, Dr. Osman. First, let me salute all the FIP team for your great effort in this big battle against COVID-19. Second, I will give you a small reminder about the population in Lebanon. We have 4.5 million Lebanese, and we have approximately 2 million non-Lebanese refugees in Lebanon. About vaccination, we had till now 25% are fully vaccinated. We had administered about 3 million doses up till now. Going back to the strengths and priorities regarding vaccination, equity, and access, I could say that we had an early access to vaccine. This was one of the strengths we had in Lebanon. We had, through the COVAX platform, an early access to vaccination from Pfizer and from AstraZeneca. So this was one of the strengths that helped us in vaccinating the population. Second, the other strength we had was the diversity of the sources of vaccines. When we had it from Pfizer first, and then from AstraZeneca, this was an extra strength to us, so we could change from the ages of vaccination and use all the sources that we had in this part of vaccination. Third, vaccine availability was free of charge for all the people in Lebanon through the Ministry of Health. And this was also one of the strengths we had. This is free of charge. And we had some private sectors which tried to interfere, but in a small, let's say, amount. While like political parties, they tried to interfere by buying, let's say, vaccines and trying to give them to the population in their regions, but for free also. And the fourth strength we had in this regarding access and equity was the equity in distribution, because vaccines, they were available to both Lebanese and non-Lebanese without discrimination. So this vaccination was available to both all the Lebanese and non-Lebanese in our country. Going back to the next, please. Going back to the weakness and the challenges regarding the vaccination, equity, and access, well, at first we had a vaccine hesitancy in rural areas. You know, Lebanon is small, but we have rural areas. We had, let's say, in the north of Lebanon, only acceptance of vaccinations
I think we may have lost Dr. Ziad momentarily.
So let's wait to see if he's connecting again.
In the meantime, we're getting lots of very positive comments about the presentations, thanking each and every one. I'd like to remind everyone, if you have any questions to the panelists, please send them to the Q&A box. We can pick those up towards the end. That would be really, really helpful. I think Dr. Ziad has disconnected, and I'm sure he'll be joining again. Dr. Ayman, since I have you here maybe until Dr. Ziad joins, what are your reflections on what you're hearing with regards to this transforming vaccination agenda in the EMR?
I believe that if you talk globally in the MRO area, I believe that the efforts are organized well through the governments. However, I have a notice here that, you know, about my concern about the role of pharmacists in that effort. I could see that there is some sort of disconnect between the fact that the pharmacist is the most accessible professional, healthcare professional for the community, and the action here that the governments are not really getting the pharmacists into the game and playing the role that is really important for the community. Except I can see that Dr. Ola mentioned that this is happening only in Jordan, and I applaud them for that, because this is the move that we need to have to make sure that the pharmacists involved in vaccination, especially in a time of epidemic like that. The pharmacists, you know, need to be more involved in that issue. I can compare that with what's happening in the US, because I know that the vaccination campaign already is well established in the US, where pharmacists are vaccinating, you know, delivering all the vaccines to the community. And this is a real good use of the pharmacist knowledge and experience, and also access to medical care for the patient. This is critical, and they realize that in the US. I hope that we can continue in our campaign to move into having this as a standard process where the pharmacists will be involved in vaccination. And it is obvious in the time of the COVID-19 that, you know, we can have a big advantage of getting this access to vaccination to the community, because we have pharmacists is there next door. And this can make the whole process easy, other than just going door by door and having campaigns and having centers and sites, which is okay. But I believe that we can take advantage of the pharmacist presence in the community as a community servant, and also as a nice professional access to healthcare, including vaccination. This will be a big plus for the community. I hope that we can have the campaign of having pharmacists as immunizing professional. I think this is very important. I hope that we can build on that. I applaud again Dr. Ola and the guys in Jordan, because they did it, and they campaigned, and they really joined force with the FIP, and now it is a fact. I hope that they can move forward with the COVID-19 as well as the flu vaccine.
Thank you so much, Dr. Ayman, for these reflections. And I can see Dr. Ziad has joined us again. Welcome again, Dr. Ziad. Can you unmute?
Yes.
Thank you. We've just waited for you to come back again and just heard some reflections, really helpful ones from Dr. Ayman. So
I'm very sorry, you know.
No worries.
I'm very sorry, but this is electricity in Lebanon, and You know, we have all the time shortages, and this is unexpected.
No, we understand.
I'm very sorry.
I'm very much aware of the electricity issues in Lebanon, and that's very upsetting to hear, but we're really grateful you're with us. So please continue. The slide is on the screen, and yes. The floor is yours again.
I started the weakness and the challenge regarding to the vaccination. Isn't it that? So
yes.
Yes. So the weakness we had at first is that there has been a hesitation in rural areas. 7% of the North region, they had acceptance for vaccination. Also, we had the opposite side of this problem. 90% we had acceptance in the capital, Beirut, and Mount Lebanon. So you can see the differences between the regions in accepting this vaccination. This was due to the lack of public awareness on the importance of vaccination in regions. So this was a second weakness we had, the lack of public awareness on vaccination in this part of the in these regions in Lebanon. And the other weakness we had was the low number of qualified vaccination centers in regions. So this was the third weakness we had. And the fourth one was the lack of go-to patients initiatives, such as mobile clinics, especially when we talk about the level of refugees population, which have limited transportation means that we have to go to them to vaccinate them. They cannot afford to move from there where they are living. Next, please. I can continue. So the one policy change that can increase access to vaccination and help active equity was by far the increase authorized centers of vaccination through partnership with the pharmacists in all regions. Pharmacies are spread in all over the corner of Lebanon. So they are in contact with all the population, and they are well listened by the people. So they can put, let's say, increase a great amount of, and convince them to get the vaccination. Second policy change we must do is the most important role of the pharmacist, beside dispensing the medicine, is his role in the prevention and the awareness education of the patient in order to reduce the diseases. This is very important, prevention and awareness education to patients. With the vaccination through pharmacists, we decrease the possibility of diseases. So if we want to vaccinate the largest population possible, we should amend the law, allowing the pharmacist to administer the vaccine to the patient. This is an urgent thing to do. But before that, we should train the pharmacist and allow him to obtain a certificate to be able to vaccinate patients. The third policy we could do is we could use the idea of marathon in rural regions to increase vaccination. We tried it in some regions in Lebanon, and it was a success by using this marathon vaccination. And the fourth, we highly recommend also a common declaration between WHO and FIP asking all the governments to change the law allowing the pharmacists to administer vaccines to the population. This is a highly recommendation, because we think that a letter from the FIP with the WHO will push the governments in changing the law, allowing the pharmacists to be in part of the vaccination. You know, if I give you an example, in Lebanon, we have 3,000 pharmacy in all over Lebanon. If each pharmacy vaccinate 40 patients per day, we could reach all the population in 1 month. Imagine in 1 month we finish the whole population of Lebanon. Now we are at 25%. Imagine, and we had 6 months or 7 months of vaccination. Thank you very much.
Thanks, Dr. Ziad, for this nice presentation. I really appreciate your campaign, and I join your voice and force to campaign for pharmacists' role as a professional who will administer immunization and provide healthcare at the community pharmacy, because it makes sense that we can have a pharmacy next door to the patient. Yes. And access to medical care is really very important, especially in our region where we have some problems for patients to reach out to the medical care. So we can solve it simply by having the pharmacist being there, and by default, the pharmacist is there in the pharmacy in each street. So this will be a blessing to the patient, and I think this is our major aim, is to have, you know, the best care and access to medical care to the patient. So I really thank you very much, because I add my voice to your voice, and hopefully you can have, you know, the model that was really well organized and played in Jordan. I hope that we can spread that model to all over the country, the area, and this is basically a campaign to the governments to make sure that there is a law that allows pharmacists who are trained to administer vaccine to the population. Dr. Riyad, thank you very much. Thank you very much. Now
thank you very much.
You're welcome. Thank you. Now to move to our friend from Yemen, Dr. Mohammed Al-Nuzili. He is the governing board president of Yemen Community Pharmacy Syndicate. Dr. Mohammed, go ahead. The floor is yours.
Mr. Happy to join you.
We're just checking if we can hear Dr. Mohammed.
You listen to me?
Yes, perfect. If you can keep the mic close to your lips, that would be great. Thank you very much.
Okay. Hi, everybody. Good afternoon. This is Mohammed Al-Nuzili from Yemen, from Kopos, Yemen. We are a community pharmacy association. We're dealing with the community pharmacy development in Yemen. Next, please. Firstly, current situation. Before current situation, Lina, do you listen to me?
Yes, this one?
We will talk about the demographic data of Yemen. As we see, there is 51 male and 49 female. We know that there is a shortage in the female. 80% are located in northwest, 20% are located in southeast. Unfortunately, because of the war, this ruled by different local governments. Next, please. Current situation. Current situation, more than 200 healthcare professionals was died by COVID-19. From total healthcare professionals are 28,000 registered healthcare professionals. The only supplier of vaccine is UNICEF through COVAX. Current war and conflict separate country into two partitions, unfortunately. Vaccine anti-science is present strongly, theory of conspiracy and etc. Regulatory bodies and health authority are weak to take clear decision about vaccines. I mean, especially FDA in Yemen, they don't have more specialized persons to written and deliver reports. Pharmacists have no role in vaccinations. Daily deaths by COVID based on reports are 14% per day. Fully vaccinated are 13,322, which represents 0% of the total population. At least one dose, 300,000 cases represent only 1% of population are vaccinated. 360,000 from AstraZeneca. 360,000 from AstraZeneca, 150,000 from Johnson & Johnson for COVAX. 80% of population in Northwest only received 10,000, unfortunately, unit, which is nearly expired. Equity and accessibility is not present due to multifactorial, like social, economical, and political factors. Next, please. Our plan, we will talk about opportunity. UNICEF and COVAX as the supplier, it is good opportunity because the government don't pay for the vaccine. Nearly 5,000 pharmacists and pharmacy distributed overall the country, like Dr. Ziad Nassour, we can achieve or complete the total populations in 1 month. COPOS Yemen as a professional association for community pharmacy is present strongly. Application could be created easily. That is, I mean, digital applications. FEB has arrangement with UNICEF and WHO. Next, please. Our plan.
Dr. Muhammad, are you still with us? I think Dr. Muhammad is facing some technical issues. So we've received a couple of audio recordings from Dr. Muhammad, and we will be proceeding with the event whilst having these recordings on.
Our plan, UNICEF work with COPOS Yemen to train pharmacists, place awareness campaign for vaccination, give fraction of operation costs to the pharmacist to cover infrastructure and costs of vaccination. This needs some coordination from our FEB with UNICEF. It's important to note that healthcare professionals must be covered first in both areas equally. Thanks for your attention and listening. This is Mohammed Al-Naziri from Yemen.
Before I get back to you, Dr. Ayman, I just want to check if we have Dr. Muhammad back.
Here. Yeah, Muhammad is here. Dr. Muhammad is here. Yes, he finished his presentation now. And thanks, Dr. Muhammad, for your presentation. I think you gave us a clear view about the situation in Yemen, and I'm really feeling distressed to find that there is lots of variability in the access to vaccination and equity between different areas in the EMR area. And in Yemen, I see that you guys are having some major problems, and I'm not quite sure how can the COVAX program help here, and how the WHO would help. This is a liability for the world to have access to vaccination is that poor or that difficult for loss of population, millions, and this is really I believe this is really dangerous to keep it this way. And I still join my voice with the FIP and the Jordanian guys, and the efforts that to make sure that we have access to vaccination. And again, I still emphasize that pharmacists can play a solving role for this problem. Hopefully we can keep our campaign. I think we have to join force, and we have the FIP work with the WHO, with the governments, and make the model of Jordan applicable in different areas, and make it working model to have access to vaccination is easy. The other side of the story is that to have access to vaccination through supply of the vaccines to different areas in the world. And I can see here that there is really unfair distribution of the supply, where you have the rich countries and the countries that can have the capacity to build their own manufacturing sites for vaccines enjoy vaccinating 70 or 80 of their population with 2 doses. At the same time, other areas in the world, like we see here in Yemen, it is 0. This is really not acceptable by any way. So I still believe that we have to work together to keep our voices together and join force to campaign for the best of healthcare for our patients and our populations. Okay, so now I think, Lina, we need to go for the question and answer sessions. If you can go and read or allow me to read the chat area with the questions, and we can ask our speakers to answer the relevant question, please. So Lina, go ahead and we go to the question and answer session, please.
Thank you, Dr. Ayman. I will be handing over from here. I just want to check with Dr. Mohammed, as we've lost him for a few moments. Dr. Mohammed, we've actually played your audio recordings. Would you like to add anything to what we've presented? Any reflections, any final reflections?
Thank you. Dr. Ayman speak instead of me, and he's totally right. We need the support of FEP and support of colleagues to start and initiate pharmacists in this way and to vaccinate the people also.
Thank you, Dr. Mohammed. Dr. Ayman, I can't see any questions in the chat box. Do you have any questions for our speakers? We'd like to encourage you. Please, if you have any questions, please share them in the Q&A box. We will make sure to address these. Dr. Ayman, do you have any specific questions that you'd like to address for our speakers? Dr. Ayman?
Here. Okay, thank you, Rola. I think my questions, Dr. Rola, simply is to please explain to us how their model in Jordan succeeded in getting the campaign for the FIP support a successful story. It is really something that we have to learn from you. You succeeded in Jordan to have this model implemented. And I believe that this is a big step to build our pharmacist role in the community as a healthcare provider who is available and accessible. And I think I believe that the starting point is from the immunization, because there is also a critical need. There is a need for someone to help the community, and the pharmacist is really well equipped to step in. But what's happening is that there is lots of roadblocks for this role, and I can see that you guys succeeded in crossing these roadblocks, and now we are enjoying this thing. And I hope that you can develop it more into beyond the flu vaccine to get to the COVID-19, and that model is already established in the USA. Years ago, and I was talking to a friend of mine in the US. He told me that in the community pharmacy there, they are vaccinating for the COVID-19 daily, and this is part of the service to the community. How did you do that? And explain to us, and maybe you can give us some guidance for other audience and other authority members here for pharmacy syndicates, how they will go, what will be the success story, and what was the model that you, or the road that you followed to make it a success story. Go ahead, Dr. Rola.
Thank you very much, Dr. Ayman. This is very encouraging words that you gave us, and for the whole pharmacist, I think. Farah, can you please share my slides, the part with the JPA, if possible? And meanwhile, I like to say that it's just one step, and we are looking forward for even more. You know that pharmacist is very important healthcare worker among the healthcare professionals. So they need to be acknowledged for everything. And we started with immunization, but we are even looking for more than that. It was not easy, Dr. Ayman. It was not easy. You have to work hard on that. But at the end, it's going to succeed. The FIP gave us a very strong umbrella to work through. That's why joint forces is very important in order to allow the pharmacist to take his role among the healthcare providers. A little bit later, please, Farah. More. Again, also enough. No, before that, the one before that, please. Yes, thank you. So what we did, as you can see, this is the small group, the one in the bottom. This is the group that have initiated the whole issue. You know, Dr. Samira, she's one of the FIP vice presidents. She worked hard on this, and she gathered a group of pharmacists who worked very hard on this. After that, the JPA, we made a proposal, everything to show how the importance of the pharmacist in this issue. And as you know, Dr. Ayman and all colleagues, pharmacists all over the world is taking this part. The pharmacists are taking the part of being immunizer. But of course, this pharmacists have to be certified first. And the pharmacy itself has to be certified. So what we did, JPA with the FIP, they made the commitment to action on primary health care. I think also Indonesia was in parallel line with us. They made also this commitment at that time. And after that, we enforced certain guidelines for the immunization. We made many awareness and educational workshops and training programs in order for the pharmacists to be capable of giving vaccine. Of course, it's difficult to work on all vaccines at once. You know, there are many resistance is going to happen. You know that nurses, probably a physician. So we chose to start with the flu vaccine at the beginning. And we started making training on this and giving certification. And even some of those pharmacists that you can see, they took the certificate from the AFA during one of the FIP conferences in Abu Dhabi. And after that, the vaccination campaigns with the media played a big role. We went to many elderly and nursing homes, and this gave the pharmacist very strong position in that issue. Now, having said all this, with the media, as I said, Dr. Ayman, and all these factors that we just mentioned, gave us some strength, and also with the FIP, of course, they gave us some strength in this issue. After that, the slide after, please, Farah. Farah. Yes, thank you. After all this influence, in response to all this effort, we, of course, went to the officials in the Ministry of Health, and we had many meetings in order to have what we want. After that, they approved pharmacists to give influenza vaccination. But the pharmacist, as I said, has to be certified. And this is what we want. We don't want any pharmacist to do that. You know that many complications can happen. We don't want to have any incidents in relation to this to the pharmacist. Also, the pharmacy itself has to be registered in the Jordan Pharmaceutical Drug Food Association. And this is also acceptable. In the pharmacy, you have to have certain area in order, a private area, if you like. It doesn't have to be a room or anything, but it has to be private in order to be able to give the vaccination. And this has been approved. Now, as I said earlier, with the COVID-19, we are looking forward to extend our immunization program to include COVID-19 at the beginning, and probably later on include the other immunization program. And it's really a good experience. I really encourage everybody to go through it. Pharmacist is very powerful and has to be empowered. FIP can play a great role in this, and you have to just start. Make this arrangement with the FIP. Thank you.
Thank you. Thank you, Dr.
I answered your question.
Thank you so much, Dr. Rula. Just considering the time we have for the event, I would like to say on behalf of FIP, I'd like to thank you, Dr. Ayman, for co-moderating this session. I'd like to thank our speakers for sharing their national experience in the Eastern Mediterranean region. Today, we've shared strengths, barriers, and some lessons learned from different nations within the region. And some actions that we can take for our coming steps. I'd like to also thank our participants for joining us today, and would like to invite you all to the next regional roundtable, the European region, where we discuss some case scenarios and some national case studies from nations in Europe. That will be on the 14th of October, 13 to 14:30 CEST. Please join our next event, and to register for our next event, you can visit events.fip.org, or you can always go to transformingvaccination.fip.org, where you can either register for the coming events or watch recordings of previous events. Again, you can go through events.fip.org, where you will find a variety of events that covers different areas and different portfolios. Thank you again for attending. And with that, Dr. Ayman, any final reflections for the attendees and for our speakers?
Thank you guys very much for this nice presentation and this nice, discussion. I believe that we learned a lot from that session, and this is really what we need to do, is to get together and discuss issues that's related to the healthcare and especially the pharmacists. And I believe that we took the take-home message here that we need to work together. It's not just only individual effort. We need to work together, and I believe that the FIP umbrella will be a great umbrella for us to make sure that we can offer the best healthcare to our patients, and also support the efforts to move with our profession to have the pharmacists, especially the community pharmacists, who is everywhere next door to the patient, to be accessible, to provide quality healthcare. I believe that the second lesson is that we can start gradually and small, step by step, by offering, let's say, immunization. It might be the low-hanging fruit for these efforts, and it is done. It is acceptable. It is really a good model in the Western countries, and also you can see here in some of the countries in Europe, and also we see it here in Jordan, which I really applaud them for this effort. This will be a step to go forward with immunization. Next type of step will be having the pharmacists, the pharmacies as a point of care, and then maybe diabetic care, then anticoagulation care. This will be the role of the pharmacist in the future, especially in the community. The third lesson that I believe that we can get from here is that, we should start, not by just campaigning and talking and asking or pleading for some regulations. We can start by building the workforce, i.e., we need to train our pharmacists to do the job first. And the model of Dr. Rola, which she mentioned here, I agree with her, and I think the best way is to start through education and training. So we can gather lots of very ambitious and very knowledgeable pharmacists and train them. We give them training for immunization, for example, and give them license or certificate, and then took all of those examples as a model and say, hey guys, government, we have the guys who are trained, licensed, and knowledgeable enough to offer a service to the community, for example, immunization. Once we show them that we have the manpower who can take this role in the community, I believe that it makes sense that they will have to use this. This is a blessing to any government to have ability to give access of medical care to the patient with no cost, with minimal cost. And I think this will be reflected adequately to the population, who will really appreciate that, especially the patients will appreciate that. With the campaign, with the political pressure, whatever, and with under the umbrella of the FIP or WHO, I believe that we can succeed. This is my really hope, and I hope that you share with me that vision, and I can see that we already are on the same page. So God bless you, and hopefully everything will be great. Thank you.
Thank you, Dr. Ayman. And with that, I would invite all of the speakers to open their videos And we'd like to say again, thank you for attending, thank you for your participation, and thank you for sharing with us the positive reflections from around the region. Thank you again, and we'll see you soon.
Thank you everybody.
Thank you.
Thank you, Muhammad, Dr. Ziad, thank you, Dr. Farah.
Thank you all.
Thank you, guys. Thank you all.